The second metabolite of testosterone, estradiol, is wrongly considered to be an exclusively female sex hormone. But let me tell you, there are no strictly male or female sex hormones. It all depends on the necessary concentration for each sex, and all hormones in both sexes perform certain functions. So, for example, while in women, estradiol is mainly synthesized by the ovaries, in men, the main source is the conversion of testosterone into estradiol through the enzyme aromatase. And accordingly, as we mentioned, aromatase is most highly expressed in adipose tissue and in the mammary gland. People often confuse it with the milk glands. The mammary gland, accordingly, is an atavism of the milk gland in men. The brain as well, since estradiol affects the functioning of the central nervous system. In bones, in the testes, expression has also been observed in certain cells, in the Sertoli cells, because estradiol is necessary to support their normal function, and also in the liver. So testosterone, when it is converted into estradiol, is also responsible for negative feedback in the hypothalamus. In the system, and we've already mentioned the Sertoli cells, this is particularly relevant to bones. It's especially noticeable in women, but still, in men, though less frequently, if we see a deficiency of testosterone along with low estradiol levels, this leads to osteoporosis, which is more typical for, older age when hypogonadism develops. Accordingly, estradiol significantly supports bone mineral density in the body. As for its effect on the cardiovascular system, estradiol improves the lipid profile, increases the level of high-density lipoproteins, and decreases the level of low-density lipoproteins, improves endothelial function of blood vessels. That is, we are considering how the vessel can operate or function in terms of dilation due to nitric oxide, and whether it is susceptible or prone to the formation of any plaques, because usually a plaque begins with damage to the endothelium when there is something for it to latch onto. However, when the inner lining of the vessel is intact, then essentially there seems to be nothing there for it to grow on. It has been well established that estradiol affects insulin sensitivity, and with estradiol deficiency, which is often accompanied by testosterone deficiency, there is also a high risk of metabolic syndrome and metabolic disorders. One of the important effects is the improvement of cognitive functions, that is the support of nervous activity itself, as well as memory and attention.